that actually you will be often wrong, even if there's great correlative value between, and on a public level, on a population level, between a blood value and an alternative bodily fluid.
Let's go.
Hey Joris, we were talking the other day about doing sampling in the clinical lab, and blood, plasma. That's the gold standard. But I wonder if we can talk a little bit about other fluids that might be good to sample or is equivalent.
Yeah. Well, thanks for that question, Nick. We see often, especially when you take a test outside of a laboratory, that people don't want to use blood, and it's you can easily realize why, because it's less invasive.
Sure. Got to poke with a needle, get blood.
Yeah. Exactly. So in order to use an alternative fluid, like for example sweat, urine, saliva, and then there's also things like tears or feces even. You have
feces
that would be a difficult sample. Yeah, but it's a good example because it's actually really hard to get feces or tears for that matter.
Right.
But there is.
It should be hard to get tears.
Yeah, hopefully.
Designing the wrong system.
But there is other bodily fluids that are easier to get, like urine or saliva or sweat. And often in these cases, or in these instances, the clinical standards are all around blood values.
Right.
So
yes.
A real consideration there is that there is a great correlative value with blood of the specimen that you're measuring in and the blood value.
Gotcha. Right.
So that's a great consideration going in, and generally there is data, public data, that shows a correlation between, let's say, a value in sweat and a value in blood. But even if that data shows a good R-squared value, meaning that there's a great correlation, it still is very important to also consider what that does mean for a patient. So an exercise that I've done often is to look at a line in the middle. Let's say above this line, a patient is healthy, and underneath this line, a patient is diseased, has a disease.
Sure.
And then you look at the positive predictive value and the negative predictive value, which is really a measure for like how often we could tell a healthy person that they are healthy, or a diseased person that they are diseased. And generally, you'll see that actually you will be often wrong, even if there is great correlative value between, and on a public level, on a population level, between a blood value and an alternative bodily fluid.
So what does that mean then for the diagnostic? Is it even worth looking at some of these other sampling solutions or sampling fluids, I guess?
I mean, it's for sure a bit more nuanced. So one of the things we can do is track a patient over time. So for example, patient-to-patient variability is eliminated if we set the baseline for each patient prior to measurement. So one of the things you can do is test that patient beforehand and calibrate whatever their value, their foundational value is before you start measuring, and track that one particular patient over time. And it could very well be that let's say the sweat values would be very indicative of things that are happening to that one patient over time. But between patient to patient, there is greater variability. So that's one way of mitigating that.
Gotcha. Yeah, that makes sense. I guess that's a good role for what we call CXM, or continual, whatever your analyte's going to be monitoring over time, like continual glucose monitoring, for example.
Exactly. That's a good measure for that. Yeah.
Pretty cool. All right. Well, a real nice bio-focused bio break. I really appreciate that.
Thanks, Nick. And have a great day.
Have a great day.